And I've been around the block a number of times, so I do have a lot of good information to share with our audience weekly and people all over the country if they're willing to put some time in and listen to it. A lot of knowledge I've acquired over the years. And last week we were lucky to have a very distinguished guest, Dr. Ken Berry, on, who basically confirmed everything I've been saying all these years. Dr. Berry's quite a bit younger than me, and I've been preaching this message probably 20 years before he even thought of it. But anyhow, it's good to have someone like that aboard, because it reestablishes to my audience that Dr. Fitness knows what the hey he's doing. And, I attack this issue of diabetes all the time, and, the high carbohydrate diet and how he's causing all kinds of health problems with Americans. And I'm going to do it again today. Because unless you pay attention to what I've got to say, it's not going to benefit you in the long run. You are in control of your health. No one else is. And of course, his book, Lies My Doctor Told Me, Medical Myths That Can Harm Your Health, proves that point. You are in control of your health. We've become a tool of the pharmaceutical industry to make lots of money. We become a tool of the AMA to make lots of money. We've become a tool of the American Diabetic Association to make lots of money. We have become a tool of the food industry to make lots of money, not only for the food industry, by producing highly addictive food, processed foods, high carbohydrate-based foods that are high in seed oils that cause inflammatory response in the body that make us sick. They have created a market for a multi-trillion-dollar industry called drugs, Big Pharma. In fact, the number one selling medication of all time is a cholesterol drug, Lipitor, by Pfizer. Aren't they the same ones who made the vaccine, Connor, for COVID? Wonder how that, yeah. They've made $179 billion since it was first introduced in 1997. $179 billion for one cholesterol-lowering medication. Now, of course, it's really easy to do when every American in this country you start to classify as having high cholesterol to treat with a high cholesterol drug. Because back in 1960, last time I checked, if you look at pictures from back then, people on the beach, no one had a fat belly. The average female had about a 25, 26-inch waist. The average male about 32, maybe, 33. Now the average female has a 39-inch waist and the male over 40, almost 41. Cholesterol back then in 1960, the flag or cutoff number for abnormal was 300. 1980, the number was 240. Now the magic number is 200. And they're pushing that lower. Because every time they do that, they make an adjustment down. What does it do? It sells more cholesterol medication. More profit for Big Pharma. And we are the guinea pigs. Nearly 50% of people my age or older are on a statin drug. Nearly 50%. And it's going to keep going higher because they want to push these numbers low. I have talked to people who came to see me whose doctors want them to have their cholesterol down about 130. Yeah, 130. Cholesterol is extremely critical to our membranes in the body, the myelin sheathing that covers the nerves, that protects the brain. In fact, the brain is the most cholesterol-rich organ in the human body. It contains 25% of the cholesterol in the body, the brain. And these powerful statin drugs to lower cholesterol interferes and makes this, what we call the blood-brain barrier, more permeable. And the statin drugs get into the brain. And it interferes with the formation of this sheathing that protects the brain, increasing the risk of cognitive problems. You may have witnessed that the other night during the debate. Because I guarantee both men on that stage, most likely, are on a statin drug. One more than another, probably. And I'm not turning the show political. I'm just stating a fact that's probably true. And when this type of stuff happens, and then it leads to other sicknesses. We know that statin drugs can increase the risk of diabetes. And in other words, if you're not a diabetic and you take a statin drug, it increases the risk of becoming one. This has all been established long ago. And more recently, in the last couple of years, new research that came out that supports that even more. And it had the pharmaceutical industry scrambling, not knowing what to do, except saying, you got to outweigh the benefits to the risk. And if you're diabetic already and you're taking this medication, it can progress the disease and actually get you on more diabetic medications, from oral medications to possibly taking insulin. So what's that insulin do? It progresses the inflammatory process in the body, primarily in the coronary arteries. Because we know that insulin's involved in that too. And the progression of maybe cognitive issues to full-blown Alzheimer's. Because research has been done on the brain to determine that the brain has become insulin resistant. And the metabolic pathways in the brain, where it uses energy, shuts down. Two pathways in the brain. One's for glucose, that's carbohydrates. The other one's for ketones, that's fat. The glucose one shuts down. The ketone one stays open. But if you're feeding the individual or the person's eating a diet high in carbohydrates and bad fats, the kind you find in seed oils, the disease will progress further and faster. And what does that lead to? More medication. And those that benefit from that are Big Pharma. New Cadillac drugs to treat these different diseases. More money in the pocket of the stockholders of these companies. And the board of directors who go from TV station to TV station promoting the medications, where 60 to 80% of the profits or the money produced at television stations is through drug ads. Pretty obscene, isn't it? That's why I've been into this field for so long, because there needs to be somebody out there who speaks up, who deals with lifestyle. That's what I do. I can tell you all this stuff, but if you're not making the changes, it does you absolutely no good. And while I believe written material via books or audio material or stuff on the internet that you may watch and listen to does you absolutely no good unless you use the information. And most people don't and won't. It's not because they don't want to. It's because they don't have the lifestyle habits yet that are necessary to do that. And the drug companies and the medical association, they all know that. When's the last time you went to your doctor and he says, we need to get you on a low carbohydrate diet with the medications, and as you progress and get better, get you off the drugs? I guarantee never. It's here's the medication, go get it filled. Here's another drug to add to your list. I saw a young lady a couple days ago. In her 40s, she brought a bag load of medications, wanting to desperately get off of them. That's the first step. Next step is doing something about it. That's why I started my business out back in about 1994. Last time I checked, that's 30 years ago. About this time. To help people make these lifestyle changes because it's almost impossible to do yourself. Almost impossible. Even with health issues. Now, we're talking about my show last week and how Dr. Ken Berry zeroed in on a lot of things that I talk about for a long, long time. And I talk about blood sugar and insulin linked to heart disease. And this is from Tomahawk Health or Tama Health. It says, while cholesterol and saturated fats are blamed as the cause of heart disease and heart attacks, new studies indicate high blood sugar and insulin, I bet you never heard that one, also have a considerable impact on a person's risk for developing heart disease. Many diabetics are aware that they are at an increased risk of heart disease, but high blood sugar can have an equally significant effect on non-diabetics as well. According to researchers at Johns Hopkins Bloomberg School of Public Health, even non-diabetics have a sharply increased risk of heart problems if they have long-term elevated blood sugar. This poses concern because many people think they are not diabetic, then they shouldn't be worried about blood sugar and insulin levels. Now, the key thing is the insulin levels there. However, long-term blood sugar can nearly double your risk of heart trouble, even if you haven't been diagnosed with diabetes. If you do have diabetes, it's crucial to closely monitor your blood sugar level. According to Johns Hopkins study, just 1 percentage point increase in blood glucose level, the chance of a heart attack in diabetics increases by 18%. This number can be alarming, but fortunately, lifestyle changes can have a positive effect, which means watch your carbohydrate intake and look at your insulin. And a lot of you out there, when you go to your doctors and you have blood drawn, they never check for insulin. So when you go, ask them to check your insulin levels because insulin literally has a short half-life. When you eat and your blood sugar goes up from carbohydrate consumption, a little bit from protein, none from fat, your body releases insulin to process it. In the liver, it repackages it as triglycerides or as glycogen. It reprocesses it. You'll have some that will remain behind as glucose. And that insulin is instrumental in doing that. So if your insulin levels remain high, even in a fasting state, it means you're overproducing it to deal with your blood sugar to keep it under normal levels. That elevated insulin can cause inflammation in the body, primarily in the artery walls. It can cause inflammation in muscle tissue. It can cause inflammation in the joints. It can cause inflammation in the brain. It is instrumental in the conversion of these seed oils into inflammatory prostaglandins, hormones. Those seed oils that do not occur naturally in nature but are made by men, you can't find oil in a seed unless you process it, squeeze it out. You're literally getting the membrane from the seed, the fatty membrane. These fall in the category we call omega-6 fatty acids. They are two of what we call essential fats, meaning we have to get them from our diet. Well, insulin converts these. And the omega-6 in the liver is converted into inflammatory fats, which cause disease process in the body. And if you ever wonder, when you look at oils in general, and you look at margarine, they use omega-6 fats in the processing of that margarine by increasing the hydrogen in it and taking a molecule, I believe, of oxygen out to make it solid at room temperature. They can't do that with omega-3. So these omega-6s are causing inflammation in the body, but the initiation process in the liver happens when insulin tells it to do that. That's why diabetics are always in an inflammatory state. And a lot of your experts they'll tell you that diabetes is an inflammatory disease. just like heart disease, just like cancer, just like many of the diseases we have today. That's why when a person goes off their diet and eats junk, they have inflammation. You don't want that. So change the lifestyle. Number at the studio is 602-260-5394. You can make these changes. But it takes you to do it. Your wife can't do it for you, or your husband can't do it for you, your boyfriend or your girlfriend can't do it for you. Only you can do it for you. And knowledge is your first step. And you're getting that knowledge from me. Weekly. Here's another one for you. I mean, they push statin drugs out the yin-yang. They want us all on statins, when the real cause of heart attacks is the inflammation. This is from Suter Health. Inflammation can be good for your body or bad. Imagine you turn your ankle while hiking. Your body instantly activates your immune system to deal with the damage, sending an army of specialized cells to the area to make repairs. As those cells go to work, you start to see and feel the signs of inflammation, swelling, redness, heat. It's painful, but it's good. Now imagine a coronary artery that has been injured by tobacco smoke, high blood pressure, or high blood sugar. Injury again triggers the inflammatory processes in the area. It gets flooded with cells and other responding substances. In this case, however, some of those responders can do more harm than good. They can trigger a cascade of events, including disrupted plaque deposits and blood clots that can cut off blood flow to your heart and lead to a heart attack. With that, I want to welcome Dr. Greg Snyder. Okay, he's one of the group of doctors we put together with Dr. Mitchell in the Valley to help you people get healthy. Dr. Greg, how are you this afternoon?
Not too bad, Lance. How are you?
I'm doing great. We're talking about inflammation. That's the real cause of many of the problems today. And, of course, the area of chiropractic has to do with inflammation.
Yeah, 100%. Especially with pretty much any chronic disease, whether it's, osteoarthritis or, the three leading killers in the world that are all, chronic cardiovascular disorders. They pretty much all begin and end with chronic inflammatory disorders.
So how would you approach your patient who comes in, you see, okay, and this is a gentle topic, they're a bit overweight. And they're coming in there wobbling around. You know that you need to say something. How would you gently approach that person to get them to pay attention to what you've got to say when it comes to aches and pains and what's going on, what you can't see internally?
Yeah, that is always a tough one. But we talk about kind of the mechanical factors of inflammation, of how sitting and all day, maybe it's office work or just somebody who's just really not that active or into working out and regular movement, and how it's important to basically, try and just begin by walking regularly throughout the day, whether it's 15, 20 minutes at a time. I know, here right now, this season, it's a little hot outside. So, even just walking around the house, moving around the house, start cleaning, doing things where you're moving your body a little bit more, just not sitting around for too long. Just something as small as that can really help spur the metabolic process, clear out some inflammation, and obviously it has the second, you're killing two birds with one stone by, hoping by getting a little more active, we're helping with the metabolic disease as well.
Yeah, so here's one area that people don't understand, okay, that all the organs in the human body are supplied by the nervous system.
Yeah.
If you cut the nerve, the organ doesn't work, right?
Correct.
Okay.
Yeah.
So if the supply of information, the innervation of that organ by the nervous system is interfered with, then the organs interfere with, correct?
100%. Absolutely.
Okay, so it's critical that you can't get those nerves, let's put it this way, freed up, okay, from inflammation because of misalignment of the spine. You can't get that fixed by taking a medication, right?
Nope. Nope, unfortunately not.
Okay,
Oh.
so the only way to fix that, and this is why I go to see Scott once a month.
Uh-huh.
Okay, get an adjustment done of the spine and other critical areas of the body to keep things into alignment, so you can innervate not only the muscles that move the bones around, but the organs that supply the body and keep you alive.
Yes, absolutely.
Okay, so what would you tell our audience now? How to get them to pick up that doggone telephone? We're having some issues, maybe digestive problems, maybe memory problems. Okay, maybe I can say this, an irregular heartbeat. They can cause some, and you're not innervating the heart properly because the nerves that supply the heart are interfere with, correct?
Yep.
Okay.
100%.
Here's something else that you may, this is where food's tied in everything. If you think about it, God created a very, very precise mechanism, if you want to call it that, is smell. New medical life sciences, the smell and the sight of a meal stimulates short-lived inflammatory response in the brain. Get that one. Even before carbohydrates, got that word? Sugar. Reach the brain, the bloodstream, the very sight and smell of a meal trigger the release of insulin. For the first time, researchers from the University of Basel and University Hospital Basel have shown that insulin release depends on a short-term inflammatory response that takes place in these circumstances. In overweight individuals, however, this inflammatory response is so excessive that it can impair insulin secretion. Even the anticipation of a forthcoming meal triggers a series of responses in the body, perhaps a most familiar of which is watering of the mouth. You ever see a dog do that? The water of the mouth, like that, and their tongue sticks out. Wait, I have two of them that do it. They see food, boy, they're ready to go for it. My cat just looks at you with her eyes, ready to pounce on it. But the hormone insulin, which regulates blood sugar, also arrives on the scene even before we tuck in the first mouthful of food. Experts refer to this neurological mediated phase of insulin secretion called cephalic. In the past, however, it was unclear how the sensory perception of a meal generated a signal to the pancreas to ramp up insulin production. Now, researchers from the University of Basel and the hospital have identified an important piece of the puzzle, an inflammatory factor known as interleukin-1 beta, which is also involved in their immune response to pathogens or in tissue damage. The team had reported their finding in the journal Cell Biology. There we go. The same thing happens in the inflammatory response in the arteries of the heart. Same thing happens when we look at cancer. We look at kidney disease. All the different diseases in the body. An inflammatory response occurs so that healing happens. Here's another one for you. Keto, that's the ketone release from the body under when you're eating low carbohydrates, use something we call BHB, beta hydroxybutyrate. Keto, an anti-inflammatory diet for pain management. A vast majority of people who hear talk about the keto diet are using it to lose weight. It's believed that a diet high in fats and low carbohydrates will put your body into ketosis. Meaning that it will feed or create energy rather than feeding on carbohydrates like those found in bread and nuts and fruit. Aside from weight loss potential that come from the keto diet, many articles recently have noted the potential for this kind of metabolic shift to reduce inflammation. Inflammation, you're sure you know, one of the main causes of pain, both chronic and acute. Reduction in inflammation actually sounds great, doesn't it? Well, research shows that it does this. Because again, you look at the inflammatory response that are occurring in the cells itself, initiated by insulin, telling it to do that. Well, these cells use energy. And when you're on a high carbohydrate diet, it's not using the ketones that are being released for fuel. These same ketones take down swelling in all tissues of the body. The same with the brain. That only happens when you eat a lower carbohydrate diet. You can also supplement the diet with BHB. This happens from dietary changes. They actually used to use a low carbohydrate diet and many neurological problems in children. They're using them now in study. They're studying this in laboratories in different not only hospitals but universities all over the country when it comes to Parkinson's, when it comes to MS, when it comes to Alzheimer's, when it comes to epilepsy, which was used, I said originally, with children. They put them on a keto diet to control the brain from going into spasm. So ketosis reduces inflammation by reducing the amounts of insulin, which increase inflammation. Also, this insulin increases the amount of free radicals. These molecules inflame the linings of blood vessels and stimulate the body's immune system to respond. Chronic diseases that can cause chronic pain. That's why when a person goes and eats the wrong types of food, they have a soreness and stiffness and pain. I can tell you myself, I experience that. When I have a cheat meal, the next day I have cheat pain. In a couple of days, it's gone because my body returns to normal. So we've been talking about, rehashing of the show from last week with Dr. Ken Berry. Okay, and we talked about his American Diabetes Society. Okay, he's going to go up against the American Diabetic Association because he said he approached them a number of times. He said, you guys have this all wrong. I've said this for years when it comes to nutrition for diabetics. They ignored him, all right, because Big Pharma's tied into them. They're making big bucks off of people being diabetics, people being pre-diabetics, and people being sick. I'm telling you the truth. I don't have to hold back. He says he didn't want to look at it as being a conspiracy. It is. They're conspiring to keep people sick and keep people fat and keep people on medications. They make money. If you were trying to sell an automobile, let's say you're selling a Cadillac, would you tell them to go down the street about 2 or 3 miles to the other Cadillac dealer and buy the same Cadillac there for $3,000 less? No. So if how you make money and earn your living is selling drugs, then you keep people sick and keep them on your drug by giving them disinformation. Tell them to eat the wrong foods. Well, you eat a low-fat diet, high carbohydrates, healthy for you. Well, but doc, my cholesterol keeps going up. Oh, that's genetics then. Take more statins. Oh, but doc, my blood sugar goes. Well, take diabetes medication because that'll keep it down. Well, we got to stick you on a statin drug because the statin's going to keep the cholesterol down. But doc, I had a heart attack a month ago. Well, that's okay to keep you from getting another one. You get the gist of it. The only thing that helps that is making changes in your lifestyle. You got to change your lifestyle. It's that simple. Diet, exercise, diet, exercise, diet, exercise, diet, exercise, and accountability. Because we've got a lot of information today. It's all over the internet. Dr. Berry has 3 million followers on YouTube. 3 million. But I guarantee there's not 3 million people on that YouTube changing that diet, watching them. I guarantee it, because they're not accountable. You've got to report to somebody to stick on your program. You got to face up to them, face to face. You want the truth? Tell the truth. Tell it to somebody. It's called confession. You can't confess to a computer looking at it. Well, that sounds really good. I think I'm going to give it a try. That's what I think. I'm going to give it a try. Think I'm going to give it a try. You got to be accountable.